Well, we've also heard from another doctor just a few moments ago to get a sense of what it's like for them coping with multiple coronavirus patients and all too often seeing them die. I was able to speak to one just in the past hour after she finished her shift at a different London hospital. Dr. Katie Sanderson wrote an email to let people know what was happening. I began by asking her to tell me how her shift had gone today.
It's really, really horrible. It's horrible for us, but it's obviously more horrible for the patients and for their families. There are scenes of just unimaginable sadness, and I speak for myself and my colleagues in other London hospitals. Patients are dying who have staff members who are relatives who go straight back to work. It's really, really, really terrible. And I'm talking because I know that we could have been more prepared in London, and I feel people could be more prepared elsewhere in the country.
What's the biggest challenge amongst all the enormous challenges that you're facing at the moment? Just tell us what has been the most testing thing today for you, Katie.
The challenge for me is when multiple people are dying in a day, for them not to be a number, to have a conversation with relatives, with patients about their death, the death of somebody in their family, that is meaningful and that makes it as good as it can be. And that is hard when you're doing it multiple times a day.
Do you have all the equipment that you need?
I think I personally today have had the equipment I need, but I don't think we have all the equipment we need now. And I think there is, among my colleagues here and in other hospitals, sort of sickening panic about what is to come.
And if you had a message for the Prime Minister, for the Health Secretary, from your experiences just in the last few hours, what would your plea to them be, Katie?
We're discovering all sorts of things, and I speak to colleagues friends in Scotland and all over the place, and they have no idea because they're not seeing the volumes of patients. And I obviously know much more about how to look after and how these patients present than I did last week. And I just really, really, really hope we can communicate and share all of this effectively so that others are as well prepared as they can be.